Hi, Kate.
Hey, Dr. Gupta.
How are you?
Great. How are you doing?
Good. Thank you for my Starbucks.
Oh my gosh, my pleasure.
So today, I thought we could talk about, well, number one, let's, I guess, introduce ourselves again. I'm Mona Gupta. I'm a psychiatrist in North Carolina. And I have with me Kate O'Connell, and she is tell me your therapy.
Licensed clinical mental health counselor and licensed clinical addiction specialist.
Because those change a lot. So I'm real, and you can be a therapist. First, before we get into like our topic,
Sure.
why are there so many ways to be a
There are
therapist?
so many ways to be a therapist. So, what it was originally explained to me is social worker, the MSW, LCSW, is more for macro
Okay.
issues, whereas mental health counseling was supposed to be more for micro, for the psychotherapy.
Okay.
However, I've met some really fabulous
LCSW.
LCSWs who do fabulous psychotherapy, so like the ones that we have working for us.
Yeah. So we have LCSWs, we have LCASs, LMFT.
So the LMFT is licensed marriage and family therapist. Now that is a specific type, and it is made to see families and couples.
Okay. I think it's really interesting because I think you guys all get similar education but different, and you can all work together. Like for us, we have LCSWs.
Yes.
We have LCASs.
LCSW.
And then you are a
licensed clinical mental health counselor, so is Andrew. So Andrew and me are licensed clinical mental health counselors, and then we have Andy, Philip, and Sonal.
And do you feel like you get like a well-rounded kind of, like I mean, you do groups, you do individual therapy. Do you feel like with each of your different degrees, you're able to bring something else to the table?
Yeah, I think that Andy works really well with families, and younger client.
He does really well with younger clients, I think.
Yeah, he does a family session or a family night
Oh yeah.
for IOP, active IOP patients and their families. That's on the last Wednesday of every month.
And so, a lot of times when it comes to alcoholism and drug use, I mean, families have to have buy-in, right, for the treatment to work, right?
That was our goal when we started the family night, was to educate and engage, to start engaging families more.
Great. So, and it's got really good feedback.
Yes.
Oh, good.
And
Because I feel like there's a lot of judgment that comes with, alcoholism, drug use,
and stigma and misunderstanding.
So it's really interesting. I guess we were really going to talk about another topic, but I think because we're starting to talk, I feel like let's talk about, the IOP.
Okay.
What happens in an IOP? What is an IOP? And then kind of, like you said, Andy does these family groups. I know that, intensive outpatient therapy, let's talk about what that is. If you want to start with that.
Sure. So intensive outpatient therapy, IOP, it's an intensive therapy, time bound, usually between the length of 8 to 12 weeks.
Okay.
And a person will attend therapy anywhere between 9 to 20 hours a week of group therapy. And usually we include individual therapy.
So whenever I have a patient come in and they're abusing alcohol or they're using drugs or whatever, they come in, a lot of times a family member's bringing them in. Like, you got to do something. You got to help this person, right? And so then, there's definitely a lot of times, not every time, but a lot of times. And then they come in and they're like, oh my God, you want me to be here 9 to 20 hours a week? Have you lost your mind? I have a life. I have things to do. But what I like to say is, it's either that or you're going residential somewhere. And by residential, that means you might have to be somewhere 28 days. That's what people think about with rehab. This is an outpatient form of rehab that you can do from the comfort, like really the comfort of your town or your place. And you can go to work in the morning and then come to treatment, correct?
Yeah, I think that's when you first started it. It was for the professionals in our town. We offered we still offer morning track, evening track, weekend track, And that way a person can still
fit it in their life.
Exactly.
Like we've got stay-at-home moms that are doing it. We've got professionals that are doing it. And we even have the young adult doing it. I mean, we really are open. We just want someone who wants the treatment.
Right.
So we don't want people who are being forced into treatment. So like I said, these patients come in and they're being forced into treatment. But the truth is after their first few sessions, they're so thankful.
Absolutely.
And they make the time.
Right. It's always voluntary, and that's what I like doing with programs like this, which is completely voluntary. Yes, there might be different external motivators out there, but in the end, everyone who I meet in that program is internally motivated.
So what is an external motivator? Tell me what that
External motivator would be something like you're going to be kicked out of the house if you don't do X, Y, or Z. Or it could be, well, if I fulfill this program, then I have a better chance at
not getting kicked out of work.
Right.
Yeah.
Right.
So I was listening to Esther Perel. Do you know who that is?
Yes.
I think she's maybe a licensed marriage and family therapy, but she does a lot of couples therapy. She's amazing. And she was saying that a lot of times wives or husbands will go in and they'll nag people or they'll say like, you got to change, you got to do this, you did this to me, you did that to me. And I feel like sometimes, and then what does that do? You statements and stuff like that make you defensive, right?
Exactly. As soon as you hear you, walls come up.
Walls go up. And so I think that a lot of time with alcoholism, even if someone wants help, when they're hearing those you statements, they're like, whoa, you know what? Nothing's wrong with me, right? Even if they know something's wrong with them. So what do you do for that? Like, how do you help people and their families when it comes to that?
Yeah, so I think actually communication is one of the topics that we cover in family night, and also in the IOP, the intensive outpatient program, we have sessions dedicated solely to communication. What you want to do is, a perfect example is the you statements using
I feel this way.
So I feel sad when X happens. I feel sad when you drink with our family because sometimes you say things that maybe you didn't want to say.
Yeah.
And
that just seems gentler, right? Than you drink with the family all the time and I'm tired of it, right? That sounds so harsh, and saying I feel just sounds a lot lighter, right?
You're owning your feelings, right? And you also want to be sure not to use what they call like story feelings. I think Brene Brown talked about this.
What is that?
So a story feeling is I feel attacked.
Oh, okay.
I feel invalidated. Because that also carries a bit of a story. Like, oh, so I attacked you? Or so how did I invalidate you?
Okay.
You want to go to the basic emotions: sad, angry, happy, anxious,
Okay.
disgust. So those are things that you can't argue with a person. Well, people do argue with people's feelings, but the truth is that all feelings are valid. They're just your intel, the way you're experiencing things right now. Just because you feel it doesn't make it real.
So someone I know, a psychologist I know who's actually in my family, she said facts aren't feelings. And I remember that all the time when I start getting into that dark space. I'm like, feelings aren't facts. See, I messed it up. Feelings are not facts.
Right? Just
facts are. So I messed that up. But it's feelings aren't facts, and that's huge, right? If you think about it, such a big, small 3 words can make such a big statement, you know? Because feelings are not facts. Just because you feel a certain way doesn't make it a fact, right?
Right.
And so you really have to kind of rethink. And so anyways, when it came to, my experience with alcoholism, I remember telling a family member multiple times, don't drink because you love me. If you love me, you wouldn't drink. If you love me, you wouldn't do this. Don't take that glass of wine because if to take that glass of wine, then you don't love me. Like we make those stories. That's a story. Like that's saying that someone doesn't love you because they're drinking, right?
Right.
And alcoholism is truly a disease.
Yeah. Nobody chooses it.
Yeah, no one chooses it. I don't think they want to, but it can easily become a problem. Like I was talking to a friend the other day and she was saying, I have a strong family history of alcoholism, And it scares me, and I feel like I have that too. And so for me, I never drank for so many years. And I would say in my 40s, I've started to pick up a glass of wine or whatever. But my whole life, I never drank because I was scared of that addiction gene, you know?
Right.
And now, I find that I'm so stressed. Sometimes I'm like, I'll just have a glass of wine. And then that scares me because I'm coping with it. Do you feel like that becomes a problem sometimes?
It can definitely under age 25 when the brain's still developing. You really want to be careful of any type of drugs, alcohol you introduce to the system, which is a lot of times when we're doing that type of stuff.
So what do we do with the college kids? How do you tell them? Do we need to educate them better?
That's a good point. I think that what I've run into is balancing between giving education and sounding preaching or trying to like convince a person of my point of view. There is an author for anyone who's looking for just a very non-biased but good information on alcohol in general is Annie Grace.
Annie Grace.
Annie Grace, yeah. So
And what is she?
she wrote the alcohol experiment, and I think it's called The Naked Mind.
Okay.
But she talks about all alcohol really being a poison, and how it's made innocuous in our culture through media and advertising, and now it's got us.
Well, even in medicine, they said one glass of wine is going to be good for your heart, but they've actually discounted that. That's not even true. No amount of alcohol is good for your brain
Right.
or your body, right? But, I'm not saying that alcohol's bad, right? Because I do have an occasional glass of wine. I think you do
Yeah.
too. Or, cocktail. I mean, there's an appropriate way of drinking, and then there's an inappropriate way. How do you know when your family member or yourself has a problem?
So I would normally we use the diagnostic statistical manual, right? The DSM on diagnosing an alcohol use disorder. And I think that that's like a really good way of
Make
for
it black or white.
yourself
Yeah.
to make it black or white rather than to go by a feeling
Yes.
or other people's feelings on it. Look at the facts. Is a lot of time being spent focusing on procuring alcohol?
When's your next drink?
Like, does the person seem like obsessively thinking about it? And are there like, is it associated with problems in your
Functioning,
social, mental? Right.
yeah, like I mean, in your family, if you find that it's affecting your family's life, it's affecting your work life, right? And then, yeah, I mean, I think that a lot more people are prone to it and may not have gone there, but need to be watching out. Would you agree?
Yes. So I don't remember, like the appropriate amount of alcohol per week, per like.
It's less than 3 drinks a week or something like that, right? It's something like that. I mean, not 100. I wouldn't, but I think it's less than 3 drinks a week or 2 drinks or something like that.
I can find them.
Yeah.
But
I mean, a lot of people would fall in
Right.
that. And that doesn't make you an alcoholic by any means. It means start watching, right?
has increased tolerance.
Yeah, exactly. I mean, I would say in my 40s, like I said, I never drank. And now I can drink, a glass of wine, which I couldn't even do before because I hated the taste of it. But now I'm like, oh, it's not that bad. And then, I go out to dinner and I'm like, oh, I guess I'll have one. And, and then I worry. I'm like hyper alert. So I worry, am I drinking too much? Not that I drink too much in one, but even if I have a craving, like, why am I having this craving?
Right.
And it may just be that, all of us try to cope with what we have, right? And so sometimes a bottle of wine is sitting there, and I've heard over and over again that a lot of women, men, whoever, they get home and they drink a glass of wine. Well, that glass becomes 2 glasses, and then it becomes 3, and then it becomes a bottle. And so you don't even see it happening, right?
Yeah, it's definitely can be sneaky.
Yeah, it's sneaky. That's a good way of putting it, But good thing to know is we do have a program. You can call us at our office. You can, and if our program's not right, we've got tons of neighbor,
Yep.
like community partners and country, like all over the country
Yeah.
partners. A lot of times with alcohol, you can't just stop on your own. You have to detox,
Right.
and there's different ways of doing that. But mainly, when you're coming off of alcohol, you don't want to have a seizure, and it can't be life threatening. So you need a medical person to be involved.
Yeah.
But yeah, I mean, and there's some vitamins that you need to be on and whatnot.
That's what I love about our office is that it does the full lab, so it
Right.
really you're getting that medical part of it.
Yeah, so everyone who comes in, they get an evaluation. We do labs on them, full lab panel, including liver functions and kidneys and vitamins and whatnot. And then we also have a full psychological workup on them. A lot of times we'll even do testing if needed, right? Further testing. We want to make sure that we're looking in and kind of going out, right?
Yes, it's a whole body, whole system approach. We encourage the family therapy,
Right.
the individual therapy, and the group therapy.
Yeah, and kind of seeing what your triggers are and how we can help with them because triggers it might still be there, right? They're not going to go away. Life is still there. And so a lot of times people will go away and they go away for 30 days and then they come back and they need something in their environment. So if you need that or if you feel like you want an evaluation, we can evaluate you and we can send you where you need to go. It doesn't even have to be with us. Right?
Yeah, the main goal is to keep people safe, to keep
And
people having healthy life.
yeah, yeah. Well, thanks, Kate.
Thank you, Dr. Gupta.